Welcome to the Love and Guts podcast. Today I have Apple Bodemir on the cast with me. Apple is an associate professor of dermatology at the University of Wisconsin-Madison. After finishing her residency, she completed a fellowship in integrative medicine through the University of Arizona. She was the first She was the first dermatologist to be board certified in integrative medicine and currently serves on the American Board of Integrative Medicine. She's also board certified in lifestyle medicine. Dr. Bodemir is passionate about teaching and working with both dermatology residents and integrative medicine fellows, both in Wisconsin and Arizona. Additionally, she's one of the founding faculty of the Integrative Dermatology Certificate Program, an intensive program for board-certified dermatologists. She has authored several chapters in the Primary Integrative Medicine textbook and written curriculum for the University of Arizona Integrative Medicine Fellowship Program, as well as for the National Veterans Association Whole Health Initiative. Outside of the medical field, she loves to spend time with her 4 children and 2 dogs. She likes to stay physically active and loves to cook, especially whole foods, plant-based. This episode is a must listen to because it's on a topic that can be quite emotionally debilitating for a lot of people. And it's on all things hair loss. In this episode, we specifically cover what types of hair loss exists and how common it is in both men and women, the common causes of hair loss, the clinical features of female pattern hair loss, otherwise known as FPHL. Why might we see more female pattern hair loss in those with PCOS and metabolic syndrome? Apple shares that she shaved her head in 2018 as a social and professional experiment. She discusses her findings and what she experienced. This is fascinating. We also discuss how health practitioners should assess hair loss in women and men and what are some labs that we can do. And we discuss treatment strategies, including supplementation, that may be helpful in managing FPHL, female pattern hair loss. But as always, any of the information in these podcast episodes are not intended to diagnose or treat a medical condition, so please ask your health practitioner before beginning any new treatment. And this episode is proudly sponsored by Better Me Tea, a tea that I lovingly created to promote improved gut health and digestion, assisting those who struggle with constipation and sluggish bowel movements to go to the bathroom with ease. Before you dive into this conversation, if you could subscribe to Love and Guts, I would greatly appreciate it because that's how others find Love and Guts super easy, and they can also fill up on the valuable content from our hand-selected health practitioners as well. Welcome to the Love and Guts podcast, Apple. I'm truly excited to be speaking about the next topic for the next hour with you.
Thank you so much for having me. It's something that I'm really passionate about, and it's an area that I think there's so much distress that people experience when they experience hair loss.
Yeah, absolutely. It can be quite debilitating for people psychologically. So I really want to set the scene though, and just to get a bit of an understanding of how you found yourself working in the area of hair loss. Like, where did that sort of passion come from?
Well, I am board certified in dermatology, and I went through my dermatology residency, and as a young dermatologist would see patients with hair loss, and particularly women with hair loss. I was seeing the emotional distress. When somebody ends up across the table from me, they're usually very distraught, and there's almost always a lot of emotion and a lot of sense of hopelessness. And I was watching that, not quite understanding it in my, late 20s and early 30s, thinking like, well, it's just this dead structure. Why is it so important to so many people? But I also watched some of my colleagues really struggle with how to handle this condition with patients. And as I've gotten older and started sort of thinking like, well, how would I feel? As I've watched so many women and men walk through the experience of hair loss for a variety of reasons, I kind of thought, how would I feel if I was seeing somebody and they really didn't have a whole lot they could offer me? And especially when we're seeing people who have scarring hair loss in the end stages, that hair is never going to come back. And it's a really hard thing to tell someone, like, yeah, you've lost your hair and it's gotten to the point where it won't grow back. And I've kind of started thinking, well, what would I do? What would I do? How would I feel? And just trying to put myself in those patients' shoes. And that ultimately led me to do a little experiment myself where I shaved my head for 4 months.
I
And I
know.
intentionally set
Jeez.
that time because I didn't want to have an out. I knew that at some point I'd get tired of it. In the beginning, it'd be novel and sort of more exciting and interesting, and then it would get old. And I wanted to have a time limit. And I know it was very different knowing that my hair was going to grow back at the end of this 4 month period, whereas many of my patients don't have that. They're, either uncertain about how it will grow back or know that it won't. And so I created some content, educational content, and really wanted to raise awareness. I posted on social media quite a bit during that process, and then also through the process of the regrowth, which was also kind of interesting.
Oh, I'm sure. So can you, since we've launched straight into that, because you did that in 2018, and there's so much to unpack with that experiment, because that's really courageous. And what were some of the surprising things that you learned, like during that journey into baldness, for want
Yeah.
of a better way of saying it? So, and how did you feel emotionally?
Well, in the very beginning, I had a mission with it, and I was really passionate about the reason behind what my why was for that project. And so it was a fun thing to talk about. And it was awkward at work because I have short appointments with patients. And for the patients that knew me and knew me a long time, they're very concerned about me. And I sort of realized that we've kind of got cancer is now a chronic disease. And when I was in medical school, 20 plus years ago, that was only a disease of postmenopausal women, breast cancer in particular. But now, walking through the world as a middle-aged woman with young children and still fairly vibrant, in it was just assumed that I had breast cancer. It was assumed I had cancer, and in particular breast cancer. So that was one thing, realizing how like that has changed. The demographics of that disease has changed. This is not, I certainly don't treat breast cancer. I don't see breast cancer patients very often. Um, but that was one thing. And the other really probably bigger lesson was about privilege.
Mm.
And as a woman with really long hair that I would wash before I went to bed, go to bed with it wet, wake up, run my fingers through it and go, and put a ponytail in if I was just, if I had other things going on and was getting in my way. And I never really thought much about my hair. And I really certainly never recognized that that was one of the privileges I have in life. And it helped me also understand what this is about privilege. That when we talk about what privilege is, a lot of people who have it often get defensive about it, and it sort of is this this thing. And I think when you have privilege, you don't realize it.
No, you're right.
And that was what really opened my eyes, because this was a privilege I had and I didn't recognize it until it was gone, and really made me look at the rest of my life in ways that I have privilege and ways that I don't, and sort of look at that whole concept of privilege through a different lens.
Yeah. And so outside, because you had that, so I'm assuming you were mentioning that people almost judged you in the sense of she must be unwell,
Mhm.
like severely unwell, she may have cancer, that sort of thing. Was there anything else that came up for you that you were surprised about when it came to responses from people? And also, was there a time that you just wanted to throw in the towel during that 4 months and just grow it back because you felt like it was just you couldn't go on?
Yeah, well, I'll answer that second part first. Absolutely. I think it was probably about 2 months into it, and I was really getting tired of it. It hurts to shave your head. So that was one part of it, like just learning how to do that.
Yeah.
And, that's not something that most women do, but a lot of my male patients make that choice to decide that that's their hairstyle. When they lose enough of it, they just decide to go bald. And the scalp is really tender, and it hurts. And I actually ended up doing a whole sort of project on looking at men's shaving products and trying to kind of figure out which was going to work best and what were the best techniques for shaving your head. The other thing is that it was incredibly cold. I was freezing all the time. So I did this in August, September, October, November. I started at the end of August, and then it went until New Year's Eve, basically. So I was cold all the time. going into the grocery store was almost excruciatingly painful. At least in the US, we keep our grocery stores really cold. Trying to go to the movies, which with my kids, which seems almost unimaginable now with COVID, but I had to wear hats all the time. And this was one of the things. A friend of mine owns a nursing home, and she said after watching me talk about how cold I was multiple times on social media, she started just making sure that all of her patients that had bald or thin hair were wearing hats throughout the winter, because we know we lose most of our heat through our head, but it was a different thing to experience it.
You do take it for granted, don't you? I don't think
totally.
about that.
Yeah, and that's another sort of place where that privilege kind of comes in. You just take for granted that you've got, you're keeping your heat in. I remember waking up in the middle of the night because my pillow was so hot. I was losing so much heat through my head that my pillow would feel hot, and it would like surprise me. So definitely there were points that I wanted to throw in the towel and like wondered, why am I doing this? And just didn't want to be doing it anymore. The other part of that was about, how other people approached me, if it was just the cancer issue. And I experienced this more as I was regrowing my hair towards the end of the project, when I had really kind of short, stubbly hair, because at that point, it was obvious that I had hair and that having this very short haircut was a choice. And in those couple of months, I had several people come just blatantly ask me about my sexual orientation. And people make assumptions about my sexual orientation because I had a very, basically a buzz haircut. And I sort of got a taste of what it's like to walk through the world, having people assume something different than something different than the way that I identify myself, the way that I see myself. And just these cultural and social signals that our hair gives off are just really, really powerful. And and people make a lot of assumptions about other people based on their hair, whether it's sickness or lifestyle choice or even sort of personality. I was at a party for a conference I was at, and I was like just kind of doing my thing, and it was really interesting. The kind of attention I got just from strangers was really different.
Like what? Like what? Like everything that you've mentioned previously?
I think people thought that I was really hardcore.
Yes.
I met one man that assumed I was biker, and because my hair was that way, and kind of came up and tried to like just start talking to me as if I knew something about motorcycles because my hair was really short. And so just things like that.
You know what's funny? I used to have a buzz cut and short hair for a long time. Well, the buzz cut was for a short time, but I'd had short hair for a long time. And I had a very similar experience where people, when it came to sexual orientation, where people just assumed I preferred women because of my buzz hair. And also I remember one particular partner at the time, he was really uncomfortable kissing me in public because he just said he felt like he was kissing a boy. And I went,
Oh.
I know. So it's interesting what comes up for people. When you do present in a certain way, or you do show up in the world in a certain way. And how did it grow back? And you mentioned that the regrowth was interesting too, emotionally. Like, God, I could spend the entire hour talking about your experiment because it's so fascinating.
I think that was it. Sort of just the assumptions people made about me. I basically go to the hairdresser like twice a year, and I keep my hair fairly long without bangs, so it's very, very low maintenance. And so there was more maintenance involved. I had to fuss with it more than I usually do. I think I've had patients tell me, oh, it's so much easier to have short hair. And
oh God, no.
That wasn't my experience. I had to style it, and I had to like do something with it. Whereas when it's long, I don't. And so I'm very, very lucky to be able to kind of have the type of hair that I do that is so low maintenance. But when it was growing back, it was a lot higher maintenance. And I had to go get it cut more frequently just to keep some sort of shape to it. And so just sort of experiencing that side of it. But really it was in that period when it was really short, sort of shaved, buzzed. That was the really interesting part for me.
I mean, did it grow back normally? Like there wasn't any patches, there wasn't any issues with regrowing it outside of having to maintain the short hair as it grew?
Well, The only thing that caused was more gray.
Oh,
But I think
really?
that was just going to happen anyway. Yeah,
Right.
no, I mean, and
Okay.
that's one of the things I think, we see that hair grow back differently with chemotherapy related hair
Mm,
loss because the chemotherapy is actually changing the structure of the hair follicle.
yeah.
And that's what leads to the change in the hair shaft shape and diameter and color, because you have so many really, really intense changes going on to this very metabolically active structure. And with chemotherapy, the goal is to sort of target and kill very actively replicating cells, which in the case of cancer, that's the cancer cells. But hair follicle cells are also very metabolically active and they replicate all the time. So that's why they're such a target for chemotherapy.
Yeah.
And then there's some types of chemotherapy where the hair won't regrow at all, kind of ever, or that is a risk. But for something like this, where I have normally a healthy scalp and healthy hair, shaving it off, I would just expect it to grow back normally.
Mm. And your hair is gorgeous, by the way. So one of the first things I noticed when
Thank
you
you.
jumped on, I'm like, wow, you must be really grateful for it now and appreciate it
Yes, I am now.
much more. The last question I'll ask about that is your children. So you've got 4 kids.
Yeah.
How did they respond to you having shorter hair and a buzz cut? And like, was it uncomfortable for them? Did they think it was funny? Like, what was their response?
No, I think, well, we'd talked about it. I had talked about this project and I had sort of planned it and had talked about it for several months. And so they were ready for it. They knew when it was happening. Um, I had a friend who was a hairdresser who I partnered with a little bit for part of the regrowth, because I did wear wigs and I talked about the experience of what it's like to wear wigs, and she helped me with that portion of it. So I came home from getting my head shaved, and my kids ran home. They were at the neighbor's house. They ran home. My youngest, she's now 9. She would have been, I guess, six or 7 at the time. She like knocked on the door. I came down. She looked at me. She goes, "Oh, okay," and then she ran back to continue playing. And my kids really kind of took it without a beat. My oldest son at the time, some of the girls in his class thought it was really cool that I was doing that. And so he's very hush hush. He doesn't usually say much to me at all, but I think he sort of thought it was cool, but they would never say. We did have a close family friend who, he looked at me and he just kind of kept staring at me. And then he told his mom after I had left, he said, some girls would look like a boy without hair, but she still looks like a girl. And he was young. He would have been, probably 7 at the time. So, but mostly the kids didn't really, like, I didn't get stares from kids, and the
Yeah.
kids really didn't seem to be too affected about it. And, our friends' kids, they all sort of knew what I was doing about it. I did have a young girl. I was at a dinner with somebody who I hadn't met this child, and she was like whispering to her mom, and her mom said, why don't you ask her? And she asked me about my hair. But for the most part, the kids took it just in stride.
In fact, you probably just went up in the cool meter, like about
Maybe. I don't know.
5,000.
I've like dropped all the way back to minus now, I think.
I think that'll just go down as a legendary thing that you did. So, but now that we've spent 20 minutes on that, I do want to get into hair loss because it's huge.
Yeah,
And
it's huge.
and I think, we'll have a lot of people listening to this with bated breath. Can we talk about the different types of hair loss that exists? And if there's a bucket load of different types, maybe just pulling out a few.
Yeah.
And also, how common is it for both men and women?
Well, it's super common in men. So genetic patterned hair loss, it's also known as androgenetic alopecia. That's an older term, or female pattern baldness, or female pattern thinning, or male pattern baldness. That's the most common type of hair loss. And it's experienced by the time someone hits 80, probably about 70 to 80% of people have some degree of it. More so in men than in women. But I think those studies that give us that data are really looking at people that come to the doctor for it. And I think probably in women, it's just as common as in men. And that's a really frustrating part of aging. I think we talk about skin sagging. We talk about, for women, breast sagging. For men, we talk about muscles getting kind of more soft, and we talk about people getting tired and the bags under the eyes and the wrinkles. But nobody, for women, most of the time that's not talked about. And people go to great lengths to hide their hair thinning and hair loss. So it's something that sometimes even family members don't know. I have a patient who has a condition called alopecia universalis. So she's lost all of her body hair. She's had this condition for 15 years and her family has no idea. So it's something that people might not see their moms, have seen their moms struggle with it. And certainly in older generations, that's, people just didn't talk about their health or anything that might be considered vanity in some areas. And I work and live in the Midwest of the United States, and there's a lot of stoicism around kind of aging and health. So I think it's something that's very unexpected for a lot of people, and it happens gradually over time. And then there's some people that don't want to bring it up because they think it's frivolous, but they won't really share how much it bothers them. And we're starting to see that happen younger and younger. I think there's a lot of, when it comes to hair growth and hair loss, hormones play a huge role in autoimmunity. So those are the two sort of buckets that we look at hair loss from. There's hormone related and then autoimmune related. And then stress I sort of lump in with the hormone related type of hair loss. There's also another way of separating hair loss out between scarring and non-scarring. And that's a really, really important distinction to make, because when we're dealing with scarring hair loss, once that scarring has occurred, there's usually an inflammatory process that happens first that leads to the scarring. And once that scarring is there, we cannot get that hair to grow back. And so it's really important to identify that as early as we can and try to interrupt that inflammatory process. And that type of hair loss is almost always associated with stinging, itching, burning. So if somebody's got hair loss associated with symptoms, that's a time that you really, really need to talk to a provider who has some knowledge about scalp health and hair health.
Hi everyone, just a quick segue to talk about constipation. Did you know that in 2015, a survey of 3,260 Australians found that over a third of the population experienced constipation symptoms? Constipation not only leaves us feeling sluggish, toxic, bloated, and at times antisocial, it can also increase our risk of all-cause mortality by 12%, heart disease by 11%, and ischemic stroke by 19%. So if you struggle with digestive health that leaves you feeling antisocial, frustrated, and flat, maybe you've even self-prescribed to the nines with little or no results, please do get in contact. As an experienced natural healthcare practitioner, constipation is my specialty. Over many years, I have seen many patients respond well to treatment, and the good news is that sometimes the management is very straightforward. An added bonus is that my consultations are run online, which means it does not matter where you are located, I can work with you. So to schedule in a naturopathic nutrition consultation with me, simply head to my website lindagriprich.com and go to the book an appointment page there, or send an email to info@lindagriprich.com. Now back to the podcast. And what if they were to have, like, say, stinging, itching and burning, but no, at that point in time, there's no hair loss that's happening? Could those sort of symptoms occur before that exists? Or are we looking at, like, in conjunction with?
Yes, it usually sort of by the time people pay attention to it and it's bad enough that it gets people's attention, usually the hair loss has started as well. But certainly that, the inflammation starts and it progresses at different rates for everybody. And if we can interrupt it early, then that's really, really important. I want to also say that seborrheic dermatitis is a scalp condition. It's basically dandruff, and that can be associated with primarily itching and flaking. And so that might be happening if you have those symptoms. But if it's to the point that you're recognizing the symptoms and they're irritating you, then it would be useful to get some help with that. So just because you have those symptoms doesn't mean you have this kind of less common type of autoimmune related scarring hair loss. There are other things that can cause those symptoms, but it's just important to get it looked at so that it can be evaluated and identified early.
And is it the alopecia areata, the immune linked one, and the other one
Yes, so
is the
that is
androgenic?
yep, it's an autoimmune non-scarring. So that one is, luckily that hair will regrow if people can catch it, and for the isolated limited patches of alopecia, which is really the vast majority of that type of alopecia, um, that's pretty easy to get to grow back. A lot of it will grow back on its own. There's a strong connection with stress that goes along with alopecia areata. And there are some variants that are less common and also much, much more difficult to treat. So I mentioned alopecia universalis, which is a loss of all the body hair and scalp hair, and then alopecia totalis, which is the loss of just the scalp hair. There are a couple other variants where people can lose just the hair on the top of the scalp or just the hair along the kind of perimeter. And all four of those types tend to be much more stubborn and resistant to treatment.
Right. And so it just goes to show, doesn't it? I mean, even though some people may not come forward because they feel as though it might be a bit of an aesthetic thing or something that they shouldn't focus on, as we can see, there's many things that could be potentially driving it, and some of it can be a bit of a dis-ease in the body that you kind of want to get on top of. So it is worthy of addressing if there is that concern at any level, I think.
Yeah, absolutely.
So let's talk about some common causes of hair loss. What are some main causes that you find? And I'm sure that, again, there's probably plenty, but I
Right.
mean, there's some that I would love to address, but I'd love to hear what you'd like to talk about first.
Yeah, well, I mean, I think so. So the genetic pattern hair loss, there's a genetics that go along with that, but then also kind of hormonally driven. And with men, it's much more clear which hormones are driving it. With women, we're starting to get a better understanding of that. But then the next most common type of hair loss we see is telogen effluvium, and that's just a generalized shedding. And that happens, that kind of shedding from people will come in with handfuls of hair. It's coming out in the shower, it's coming out in their pillow, they're finding it all over the house. And that's associated with stress, physical or emotional. And so it can sometimes be, commonly we see this after a woman has a baby, that kind of physical stress on the body, a car accident, heart attack, loss of an important person in someone's life, but also some things like iron deficiency anemia, and thyroid disease. Those are two big things that we want to just rule out and make sure that people have enough iron and that their thyroid is working properly when we see that type of hair loss.
And what about sleep? I know that sleep can have huge impact when it comes to hair growth.
Yeah. So if we kind of think about hair, it is a non-essential structure. We don't need it. Similar to our nails. At this point, we've evolved away from really needing it. So when the body, when there is any disturbance in the body, the hair kind of gets put on hold. And that kind of also ties into when we're not optimally healthy and we're not living kind of an optimal lifestyle with sleep, stress, good nutrition. All of those things can play a role in how we function in general. But then our hair is one of the first things that we can see go from a physical standpoint. The body will put the hair on pause without hesitating because it's not necessary. So absolutely, sleep is really, really important for hormone balancing. When we don't sleep well, we kind of will flatline our cortisol levels, and cortisol should go up and down throughout the day. And depending on that, a lot of our sex hormones will fluctuate. And when our cortisol is like not doing what it's supposed to, that can interfere with all of the other sex hormones. So it's really a really delicate balance when it comes to these hormones and the way that they interact with each other. And sleep is really, really important for that. It's also like when we're not sleeping, that stimulates inflammation in general. And so that can show up in some of these autoimmune inflammatory types of hair loss.
And which is why I'm sure we're with the its influence on hormones and its influence on things like insulin resistance and metabolic syndrome, that we're kind of seeing it in those other sort of presentations like PCOS and metabolic syndrome, as I
Yeah,
mentioned.
absolutely.
What are any other sort of driving factors to hair loss?
Well, I mean, definitely nutrition, having good, a good balanced diet that's really rich in fiber and high in plant-based foods helps keep our gut microflora healthy. And the gut microflora is really important because actually we don't think about this, but they actually help control our hormone levels as well. And they're really important in maintaining a thick mucus lining in the gut, as I'm sure you know very, very well. But that mucus lining is really important when we're dealing with autoimmune related things as well. So from a hair loss standpoint, having a healthy gut is really, really important because it sort of orchestrates both the hormone side of things and can have a hand in the autoimmune side of things. From when we have that leaky gut, sort of that really exposes us to a lot more antigens and can stimulate autoimmunity.
And that is
So
cerebellome that you speak of, when that whole hormonal impact that the microbiome has, or the influence
yeah,
that the microbiome has on that, on the, say, the metabolism of estrogen, for example.
yeah.
Mm. And so what's like what about things like alcohol and cigarette smoking and all of those sort of things? Do they have like a direct impact, or how do they sort of influence hair loss in any way?
Well, cigarette smoking in particular, it causes damage to the little tiny microvessels in the skin, and those little microvessels also feed the hair follicles. So people who are heavy smokers, their hair is drier, more brittle. It's much more prone to breakage, and that's just something that I see clinically. With alcohol, it's less of a direct influencer, but alcohol, over the long term, high levels of alcohol consumption over the long term impacts hormones and can have an effect there. But we don't really have a level like, oh, if you've got hair loss, you should be avoiding alcohol. There's lots of other reasons that we should be limiting, at least, if not avoiding alcohol. But we don't have any direct links there. With alcohol, we do have to think about adequate nutrition. And so when people are consuming alcohol, those are basically empty calories. They're not calorie dense, or they're not nutrient dense calories, and they're going somewhere. So whether that's contributing to people not consuming other nutrient dense foods that are important, have important nutrients that the hair follicles need, like the B vitamins and basic adequate protein. It's really hard to get protein deficiency in any Western country these days, but it is really easy to be malnourished and not having a high quality diet. And then if people still are consuming, it can contribute to weight gain, and excess weight is also very pro-inflammatory and can just sort of feed that inflammatory fire. If you've got somebody who's already prone to this one of these inflammatory types of hair loss, it certainly isn't going to help anything.
And breastfeeding women, you were talking about like that sort of nutrient depletion, and I know that's Dr. Oscar Serelak talks about the postnatal depletion that occurs. Is that just why that postpartum period, and for some it generally happens around, say, the 6-month mark, or I don't know, it's not straight away for a lot of people, I notice. It's after a few months that they do tend to notice that sort of hair loss. Thankfully, that hasn't happened to me. Hopefully it won't. But I do hear that quite frequently. And is that just because of the nutritional deficiencies, or is there something else, going on there outside of the massive depletion that we're experiencing?
Yeah, no, actually that's a different situation. That kind of ties back to that telogen effluvium that I mentioned. And so anytime the body goes through a major stressful event, which having a baby is, the hair gets put on pause. And what we typically see is normally you have about 10% of the hair on the scalp is in that paused state, and that can increase to up to 70%. And it sort of is like all at once, the body's like, nope, you don't need hair right now. You got other things you need to focus on. We're putting you on hold. Once that stress is relieved, or the body acclimates, or if it's a thyroid disease, that's corrected, or if there is a nutritional deficiency, that's corrected, or the baby's born, and for a lot of women, you still have continued stress because you're not sleeping. And
Yes.
so there's a lot of things that can compound it, but for the most part, it really is that incidence of the birthing process being really stressful for the body. And it's common that lag is really common for that telogen effluvium, because once the hair, it takes a while to start growing up. And what we see is when the new hairs enter that growth cycle, they push the old hairs out. So actually the hair fall or the shedding that we see with these stressful events, that is an indication that hair is actually starting to grow and that the hair cycle is starting to kind of occur again after being in a paused state for several months. So it's really common between 4 and 6 months is what we expect after the stressful event. And then that the hair loss would start, and then it can go on for about 4 to 6 months. And then
Not so amazing.
It is amazing. It's amazing what the body will do.
It's amazing, but not so amazing for the person that feels like, oh
Right.
God, my hair is coming out in clumps.
Right. Yeah. And I've seen some women postpartum lose 70% of their hair. That's not at all common. I'd say between 25 and 50% is more common. And that's something I experienced I had a mild case of it after both of my daughters were born. And I knew what was happening, so it wasn't very stressful for me. And I also knew it was going to grow back. And so I just cut it so that it wasn't wrapping around their fingers, and, because it does get everywhere when that happens. But it's really, really hard to talk to a new mom who's super stressed out. She's lost sort of like her identity pre-baby, and she's struggling to find her new kind of sense of self with the different change, all the changes that our bodies go through. And then now it's like, and I'm losing my hair.
Yes.
So it's really, really hard to go through.
Yeah.
It is just a waiting game. And for the most part, especially women in childbearing years, we expect all of that hair to grow back. When it happens a little later in life, a lot of times I'll tell patients, you're at an age where we tend to see some genetic thinning. And if that runs in your family, you might not end up exactly where you were before, because you may have had an underlying hair thinning process going on that wasn't very visible, and so that's something that I just warn people, depending on their age and depending on family history. So I think that can be helpful to know if that's something that they're likely to struggle with, and with family history and hair loss, it really does follow both sides of the family tree when it comes to that genetic patterned loss.
Yeah.
I come back to that frequently because that is the most common we deal with. But this telogen effluvium is really, really a difficult one.
And can we talk a little bit about the clinical features of female pattern hair loss? I know you've mentioned it a little bit previously, but how does it appear generally for someone?
Well, usually it's thinning on top. Some women will have a recession of their anterior hairline. That's much less common. And so usually it just is that the scalp becomes more and more noticeable over time. So.
Okay. And mainly just so that sort of receding that might particularly happen, or is it just thinning on the top?
It's primarily thinning on the top. Like I said, that receding is much more common in men. It can happen for women, but it's usually that they're sort of thin on top. And it can get quite extensive, for some people. And there are things that people can do to help minimize the appearance of it, just by coloring the scalp. There's lots of cosmetic products out there that can do that to help make it less noticeable.
Yeah, which I would love to get into further on as well, just to hear some strategies that you have. But vaginal health, I know that this was mentioned. You've done a couple of courses on the Learn Skin platform, and does the vaginal health have a role in hair loss? And can we expand on that a little bit?
Yeah, at this point, we really don't know enough about connections between like gut microflora, vaginal microflora, and the skin microflora. And there are studies that are going on right now. One of my colleagues at Learn Skin is doing a study looking at the microflora of the hair follicle in women with genetic pattern thinning, just to see if we can find some patterns that might indicate some disturbances there. But I think like there's a lot of connection between just all of these there's microorganisms, but also in these microenvironments on the skin that might help give us an idea of what's going on. The type of hair loss that I mentioned earlier, the scarring autoimmune related hair loss, can be associated with a scarring autoimmune process in the genital area as well. And so there may be some connection there. We just don't know enough about that yet.
And is that lichen planus, lichen
Yeah,
sclerosis?
lichen sclerosis. So
Sclerosis.
lichen planopilaris is the hair loss. It can be associated with lichen planus, which can occur in the mouth. So oral lichen planus or cutaneous lichen planus, and then in the genital skin, when it happens, we call it lichen sclerosis.
Yes. And it's and I'm looking here, lichen planopolaris, just to get a bit more funkier with the names.
Yeah.
So is there anything else you'd like to mention about the scarring? Because I think that's a really interesting avenue to take, the scarring versus the non-scarring.
Yeah, I think really the key is to identify it early, and then, really doing whatever you can to minimize that inflammation. And a lot of times we end up trying lots of different treatments. It's really unpredictable, and it can occur in a couple of different ways. Some people can have patchy areas on the crown. And then there's another variant called frontal fibrosing alopecia, or FFA. And that is along the frontal hairline. So it's not true recession the way we think of frontal hairline recession with genetic pattern thinning, particularly in men, but they have this autoimmune attack on the for some reason, just the frontal hair follicles. And they can see actually destruction of up to 4 inches of that anterior hairline.
Wow.
So yes, it's really, and everybody comes in wanting to know, like, they won't be bald. I can tell them that, but it's really unpredictable. And it varies a lot from patient to patient with how far it's going to progress and when it will stop.
And so can we talk a little bit now about how a practitioner should be assessing hair loss in women and men? And, for example, like what would the scarring be quite obvious to the naked eye?
Yeah, so once it happens, and there's other types of scarring hair loss besides just the lichen planopilaris. That's just that is the most common one. And once the scarring has happened, it is kind of obvious. The scalp is like white and shiny and bound down in those areas. There's also this really fun, I say fun because it's a cute little name for the sign. It's not so much fun if you have it, but it's called the lonely hair sign. And for some reason, yeah, we don't know why, but you'll have the sea of scarring, this sort of big patch of scarring, and then there'll be a few scattered active hair follicles that are producing, normal diameter terminal hairs. And we don't really know why that happens. I think if we could understand why those hair follicles survive and others don't, that would take us a long way to being able to understand more about this condition. But at this point, we don't really know why that happens. And so when you see a scarred, bound down, shiny white scalp, or brown, depending on whatever color your skin tone is, it typically is like kind of a baby's butt. It's just really, really light colored because that scarring, but not as soft as a baby's butt. So when you see that, the scarring has already happened, so.
And there's no way of breaking that down. Like I know, when we're looking at, say, adhesions or mostly adhesions or some scarring in the digestive system, we might be able to break those down a little bit, or in the other parts of the body using, say, visceral manipulation. But is there any way any manual way that someone could get that broken down by a health practitioner, or is it too late?
It's too late, because what happens with this is we have fibroblasts, which are the cells in our body that help make scar tissue, and they just go in and they replace the hair follicle with fibrin, which is basically scar tissue. And then once that hair follicle is destroyed, basically, it takes out with it the follicular papilla, which is where you get the blood supply. So you really have very limited blood supply to this area as well. So we haven't found a way to do it in dermatology, and I do know with other parts of the body and other types of scars, things like microneedling or acupuncture or just really aggressive physical massage can help break up some scar tissue, but this doesn't seem to be sensitive to that.
And this, I know that sort of some of the treatments that some people might have explored would have been the platelet-rich plasma,
Yeah.
PRP. So is that something that could help in this instance? Or I think I'm clutching at straws here, that it's
Yeah,
just
no,
done
and
and
most of
dusted.
us, yeah, with this condition, most of us are clutching at straws. And it has been tried. We do have some case reports in the literature that suggest that it could be helpful in the inflammatory stage. So that's the
Okay.
key, is catching this in the inflammatory stage before those hair follicles are replaced with scar tissue. Because even if we can break up that scar tissue, we can't put a new hair follicle there.
Yes.
So that's a part of why it's so difficult to navigate. But definitely, platelet-rich plasma has been used in the inflammatory stage of this condition and has been used successfully in some providers' hands. That's not a procedure I do. I generally refer out for that. I'm in an academic practice, and it's not something we have the ability to do for our patients. But I do recommend it a lot for the genetic pattern thinning. I think that there is more chance that it can be helpful for that. And from what I've read and talked to other providers who do the procedure and seen in my patients, it's about half of patients with genetic pattern thinning that will get benefit from platelet-rich plasma.
And did you want to explain what that is for those that have no idea?
Yeah, it's a really interesting technique where you basically draw a patient's own blood and then spin it down at least twice, sometimes more than that, to get the really dense plasma, which is where all the platelets are. And platelets are really, really rich in growth factors, as well as other anti-inflammatory substances. And then you take that dense platelet-rich plasma and usually inject it into the scalp. There are other things that platelet-rich plasma is used for, but in dermatology, on the scalp, the injections are the most effective. I think people will apply it topically after microneedling. And so basically they will take it looks like a lint roller with tons of tiny needles on it, and roll that across the scalp to make these tiny micro holes in the scalp, puncture wounds basically, and then apply the PRP. That's kind of falling away. People really aren't doing that very much. It's difficult because we really want to get to a specific depth in the scalp to be able to address the base of the hair follicle and the middle portion of the hair follicle, and the microneedling is very difficult to do that with. There's also some concern that it could cause scarring, which on the scalp we don't want. So.
And so what other sort of treatment strategies, including supplementation, might you recommend for those that are managing female pattern hair loss?
Yeah,
In
for female
particular?
pattern hair loss in particular, Rogaine or topical minoxidil is what we have. Rogaine is the common name for here, but I generally recommend the generic. That is the most effective, most powerful tool we have. And the 5% product that comes in foams, liquids, applying that to the scalp at least once a day, that can be really, really effective. It can also be irritating, and there are some patients who just don't want to use that topical pharmaceutical medication or have side effects. If somebody's got really, really sensitive skin, that might make it difficult for them. And in those cases, pumpkin seed oil is a botanical that's been studied in genetic patterned hair loss. We have some human studies in men, and that look really promising for taking pumpkin seed oil orally. It is an 5-alpha reductase inhibitor. It's a botanical 5-alpha reductase inhibitor. And that particular enzyme is responsible for taking testosterone and basically supercharging it. And that can happen right at the level of the hair follicle. And it's that supercharged testosterone, or DHT, we call it, that stimulates the changes in the hair follicle that we see with genetic pattern thinning. So that's an interesting one. There are some animal models where it looks like topically it might be useful as well, but not quite as useful as minoxidil. So again, if people really want to be aggressive, I would go with a topical minoxidil. And if they just don't want to be that as aggressive, or they have reasons for not wanting or not being able to tolerate that, then pumpkin seed oil is a really good alternative. Topical rosemary oil is another botanical 5-alpha reductase inhibitor that has been found to stimulate blood flow to the scalp. And that's another thing. You could use it along with the pumpkin seed oil. From a botanical standpoint, there's also saw palmetto is a supplement. It's again another 5-alpha reductase inhibitor that can be used for people that may not want to take an oral medication for the hair loss. So oral finasteride is the one that we commonly would prescribe for either men or women, but saw palmetto is a good botanical substitute for that.
And obviously, addressing any sort of poor sleeping patterns and stress levels and that sort of thing would be highly important as well.
Yes, and I like lifestyle should come first for
Yes.
patients that are willing to really look at that and have are motivated to dive in. And from a diet, I mentioned the importance of fiber, and I really stress that in these genetic pattern hair loss patients, but also avoiding dairy. Dairy is a big driver of just excess hormones in the body in general.
Yes.
And even if you're consuming all grass-fed organic, dairy that's not treated with growth hormones, there's still, those cows are lactating 364 days a year. They might get a day off to calve, but then they're back on the milk line. And for anyone out there who has had a baby and been through that lactating process, then you know that can really mess with your own endogenous hormones.
Mm. And are there any sort of labs that you recommend health practitioners do as a first point of call?
Yeah, I always check thyroid. I always check iron levels, and I'll do an iron panel with ferritin, because ferritin gives you an idea of what your iron stores are. It is also an acute phase reactant, is a kind of fancy way of saying that it is a marker of just general stress and inflammation on the body. So sometimes it can be high when your iron is low. So that's why I combine the two. Depending on the patient's symptoms and family history, I may just do a TSH, or thyroid stimulating hormone, or I may do a panel looking at the T3, T4, and reverse T3. And in some patients, I may even look at the thyroid antibodies just to get an idea. I'll go a little deeper. But for patients who maybe aren't at as high risk, I don't generally do that out of the gates for everybody. And then I always check a vitamin D.
Yeah. And what about things like, do you ever find it useful to do things like iodine? And do you ever see iodine deficiency as being a bit of a driver? I mean, it may be affecting the thyroid, so in that aspect.
Right. And it's pretty, iodine deficiency, at least here, is super, super rare. So it's not a high yield. If the thyroid is out of whack and we can't quite explain that, then I might go hunting for that. There's other signs that patients might have that might make me think about zinc, because zinc is a really important mineral when it comes to hair health and nail health in general. So if I see a patient who's struggling with their hair and also has kind of like white spots on their nails, I find that's a useful time to check a zinc level.
Yeah. And what about like hair transplantation and low level laser light therapy? Do you find those useful at all, or do you ever recommend those?
Yes, I do. I think that the hair transplant is very provider dependent. And so you really want to have a surgeon who has a lot of experience with that procedure. I live in a medium-sized college town, and we don't have anybody locally who does hair transplant anymore. There was one person that did it here. And so I generally send patients to Chicago to make sure that they have a surgeon who has enough volume to make sure that they're really comfortable with the procedure. It's very involved, very expensive, and very time consuming. But I have patients who are super, super happy with the results they've gotten, and really, it's been a huge blessing for them.
What about like long-term side effects of those sort of treatments? Do you know of any, like hair transplantation?
Well, they'll continue to lose hair. So one of the things that can happen, the transplanted hair usually sticks around. And so they can end up with some very unusual patterns of hair loss.
Right.
Long term. So it's important to kind of recognize that it's something that you might want to get touched up if you're going to commit to doing that. So that's one thing. And with the low level laser light devices, I've got patients that have used those, and I can't say they're time consuming, and you really have to be very consistent with them. And I think what I've seen is that people get kind of over it before they would have a chance to see real benefit. Yes. So in my patient population, I haven't seen great results. but it is very time consuming. The helmets are the most convenient. However, if you have someone who still has hair, it's really difficult for those helmets to actually get the light delivered to the scalp. And so in those patients, if you still have hair, the combs are probably a better option, and they just are much more time consuming.
Right on cue, the dog's coming in. We love it. And
yes,
Ava in the background screaming. It's perfect. The perfect chaos. And I've only really got one more question for you, but I did want to ask though, before we move on, hair transplantation. So you saying that excuse my ignorance, I've never really recommended anyone to do it or know a lot about the procedure, but can it only be done on heads that are able to actually grow hair, or is it, say for example, someone that has scarring and then there's just no ability to regrow hair back? In that scenario, you cannot do hair transplantation. Am I wrong there?
Yeah, in that situation you can't, because you don't have a blood supply that will support.
Okay, so it requires that to do the hair transplantation.
And you do have to have, so usually there's two different ways of doing it. There's the strip, where they'll take a strip of hair off of usually the posterior hairline, and then sew that bit of the scalp back together. And then they extract the follicular units from that strip and make tiny little holes in the scalp, and then kind of put those plugs in the holes. So the older treatments, it was really plug-like, and it looked really kind of funny and awkward. The surgeons have gotten a lot more sophisticated, and they have devices that help them extract just a couple individual hair follicle units, so that and they have the ability to insert those into the scalp, the target area of the scalp. The other way is that they just go into the scalp and they just take individual follicular units out scattered on the scalp. So somebody who doesn't have a thick kind of posterior hairline, they might do that way. So, I mean, if you can imagine, hundreds of thousands of hair follicle units that you're trying to get back into the prepared target area of the scalp, it's very, very time consuming. And it usually costs, at least in the US, upward of $10,000. Yeah. So it's definitely a big investment.
Like breast implants, when you think about it, you know what I mean? Yep. Which is why I kind of asked the question about side effects to that, because, as we know, breast implants, there is that sort of breast implant illness that people are experiencing now. So lots of people are, not everyone, but
yeah. Well, you are kind of transplanting the patient's own hair follicles, so you don't have like foreign structures introduced.
Yes.
With that, at least. But then the other side effect is that follicular failure happens, so that not all of the hair follicles will make it. Yes. And you can't really predict that. And so some people, they may go through this whole investment, and I think it's really, really important that if you're going to invest that kind of time or money, that, or even with the PRP that we talked about earlier, because it's the patient's own blood, the quality of that platelet-rich plasma really depends on the patient's baseline health. And so if you have a patient who's not been taking good care of themselves, or they're, not sleeping well, lots of stress hormones, that can affect the quality of the treatment. And the same goes with the hair transplant surgeries. Right?
Well, it's actually not such a bad thing, in the sense that it'll hopefully cause people to focus on the fundamentals first, getting on top of stress and sleep, and looking at what their hormones are doing at that point in time, and, what's happening with blood glucose levels, cortisol, all that sort of stuff, before they tend to move to these other hair transplantation, platelet-rich plasma, low-level light laser, all those sorts of things. So I think that, if they come in with that baseline, or they've focused on all those things first, then these other things might be really useful. But if they don't work because those things aren't addressed, then it's motivation. So I know it's your Sunday Eve, very late in the evening, so I just want to put it out to you, is there's anything else that you'd like to say to our audience when it comes to hair loss?
I think we've covered a lot.
We have.
Like we've done a big, like, just all over the place in terms of all the different types of hair loss and the different ways of addressing it. I think the only thing that I would say is that as providers taking care of people with hair loss, we really need to take that seriously.
Yes.
And the psychological distress that people feel can sometimes create, it sort of gets into this just negative cycle of the hair loss creating more stress, creating more hair loss, creating more stress, and really trying to meet the patient where they're at, or the person with where they're at, and addressing their concerns and not writing them off is really, really important. I've seen patients who've been written off by doctors, and they just feel really unseen and unheard. And so I think we do them a great disservice with that. And then for patients that or people that might be listening and struggling with hair loss, that it's the hair is a reflection of our overall health and our overall well-being. And so so it's okay to be concerned about it, and that it's not bad to be vain about certain parts of our appearances, because sometimes that can be a clue to something else going on.
Yeah, absolutely. Thank you for the symptoms that come up that cause us to look into these things a little bit further, and do you think that that's when it comes to, say, people being written off, do you think that possibly some health practitioners may not be aware of what to do in these scenarios, or is it more a case of this is not an issue, it's just a bit of hair loss, no drama? Like where do you think that's coming from?
I think it can come from a lot of different reasons, and I train residents, and so I've seen people handle it really, really differently. And I think we all are kind of on our own path. And some of the residents that I've worked with that have had the most difficult time addressing hair loss with these patients are ones that are actually struggling with it themselves. So I think sometimes it might sort of, we all have a personal story around hair and a personal attachment to hair, whether we think we do or not. There's something, just culturally, we're programmed to kind of look at hair in a certain way. And so I think some of it is also definitely like not knowing what to do, or feeling like, well, your hair looks thick to me.
Yes.
And this is not a big deal. Go, why don't you come back when you've got a real problem? I've definitely seen providers approach it that way as well. And I think that's when somebody comes in telling me they've lost 50% of their ponytail density, I have to just listen to that and believe them. And so some of these patients, they look like they've got, more hair than most people I see, even with losing 50%. But I think we just have to kind of take their concerns seriously and address them, and bring kind of knowledge and compassion.
Yeah, absolutely. Absolutely. So, where can we find you, and what's next for you? And also, where can we find the breakdown of your story in 2018? Where you is that still available to us to read? Because I would love to go back and read that.
It is a work in progress. So I have a lot of content that I still haven't gotten out. I've struggled with the balance of motherhood,
Yes.
caring for my patients, and then all of these other kind of projects and ideas that I have. But I do have a website. It really hasn't been touched in a very long time. And I'm hoping to get back to that soon, but I'm on Instagram. I don't post a whole lot now, but all of my old posts are on Instagram and Facebook at Apple Skin Health. And then my website is also appleskinhealth.com. There's going to be a little bit more information there. And if you go to my Instagram account, mostly what I post now is like hearts that I find in random places, because I really haven't had a chance to devote a lot to this. But this is my year. I'm planning on writing a book about the experience of, and kind of pulling in the historical significance of hair and the cultural significance of hair across different cultures.
That sounds fascinating. Please do.
So that will be coming.
Yes.
I'm not sure when. I am a provider at the University of Wisconsin in Madison, and I do a fair amount of media outreach for the general public. And so if you look for me on YouTube, I know that I do have some, basic, kind of the things that we want our patients, as dermatologists, we want our patients to know before they come to see the dermatologist. And I've got some basic information about acne and rosacea, and sort of the the common things that we see.
Oh, fantastic. And I'll pop all of that in the show notes of
Okay.
where we can find you. And you've also done, a fantastic article, as well as, was it a webinar on the LearnSkin platform?
Yeah, I've done podcasts there. I'm one of the core faculty instructors for some of the continuing medical education work that we put out at LearnSkin. And yeah, I have a bunch of articles that I've either written or been quoted in various media outlets.
So please make sure you check that out as well. So thank you so much for spending the last hour and a bit with me on your Sunday evening. I'm
That
glad
was
we
my
got
pleasure.
Oh, you're very welcome. And I'm so happy that we got a bit of an appearance from the dog as well.
It wouldn't be anything to do with me if she didn't bark at least once.
Yeah, it humanizes it all, doesn't it? It's like this screaming baby in the background. It's like, no. But anywho.
Yeah.
But thank you guys. And if you have enjoyed this conversation that I've just had with Apple on all things hair loss, please make sure that you share it with at least one other person in your life that you know will benefit. And while you're at it, please leave a ratings and review and subscribe to Love and Guts, because that's how it gets found super easy. And so others can fill up on the fantastic information that our hand-selected health practitioners have provided. Thank you for making it to the very end of this podcast episode. One more thing before you go. If you struggle with digestive health that leaves you feeling antisocial, frustrated, and flat, you've self-prescribed to the nines with little or no results, please do get in contact. I have seen many people improve the quality of their life simply by seeking the support of a qualified health practitioner such as myself. The good news is, my consultations are run online, which means it does not matter where you are located, I can work with you. To schedule in a naturopathic and nutrition consultation with me, simply head to my website, lindagripprich.com, and go to the Book a Consultation page. Or send an email to info@lindagripprich.com.